Hi, welcome to Ask the Counselor Show. I'm Counselormsvee, and I wanted to talk today about some anxiety disorders. A lot of times, anxiety comes from different types of things. You can be born with it. It could be situational because of COVID, because of other situations that's going on in your life, or it can come about just because of a certain circumstance that you've been in. So I want to go over the about 4 or 5 main ones that I see in counseling. And the first one is generalized anxiety disorder. And when you say generalized anxiety disorder, that's the general anxiety. Is problem sleeping. Is very, very similar to panic attacks, but it's less severe. Um, um, you'll be irritable, feeling nervous, on edge. Um, there's a lot of different things. Trembling, feeling tired, feeling weak, hyperventilating. Those are some of the things you want to look at with generalized anxiety disorder. The second one is a little bit more severe, and that's panic disorder. Oh, and also with generalized anxiety disorder, you can have what they call an anxiety attack. You get really, really anxious, short of breath. Like I said, all of the characteristics that I named, and you do these episodes and have these episodes either periodically throughout the day, in certain circumstances. And I'll get to all of that and what to kind of look for and what you can do when you have one. The second one, like I said, is panic attacks. Panic attacks is more severe than anxiety attacks. This is a lot of times panic attacks. People think that they're having a heart attack and they're having a panic attack. So usually, they check you at the ER or something. You go to the ER and they check you and they say, "Oh, he's having a panic or she's having a panic attack," and it's not a heart attack; it's a panic attack. The same thing applies. Uh, um, Dizziness, the pounding of chest, hyperventilating, trembling, a sense of worry or fear. Those characteristics are the things that you experience when you're having a panic attack, and you can be pretty much de- um, just can't move because you're so panic stricken. The third thing I would like to discuss is substance medication induced anxiety. And you'd be like, what? Substance medication induced anxiety? Yes, certain types of medication can cause you to have anxiety attacks when you never had anxiety before in your life. So you want to be careful and you want to kind of be cautious of that. Also, certain alcohols can cause that. If you smoke, marijuana, or if you indulge in any other street drugs, you may experience anxiety from those substances. So you kind of want to be careful looking at that. The characteristics of that would be anxiety and panic disorder. You feeling like you're having an anxiety attack or a panic attack that's caused by the drugs or alcohol or medications, and it usually is caused when you're intoxicated with the medications, or if you're withdrawing from the medications, or if it's a new medication that can also cause it too. So just be mindful of your body, be mindful of yourself. Let your doctors know. That's the most important thing. You may be on certain medications for a while, and then next thing you know, he switches it, and now you're feeling panicky and shaky or nervousy. Let him know or let her know, this medication is doing this to me and I've never had that before. Don't just shun it off as, whatever. if it doesn't make you feel right, then let somebody know, that this was not the case before. Agoraphobia. Because of COVID, um, a lot of people have been in the house, and agoraphobia is fear of leaving your house, fear of being in closed areas, fear of using public transportation, fear of shopping with others. You want to shop with others, or you don't want to go by yourself. Um, Fear in closed places. Did I say that already? But you just want to be mindful of that, and because we've been in this COVID era, this is the new norm for everybody, especially if you have pre-existing conditions. So you're very, very mindful of, I don't want to be around nobody, because maybe you've had the shot, maybe you haven't had the vaccine. You're just still mindful. And a lot of times, because of COVID, people are relying on DoorDash. People are relying on, what is it, Instacart. And those, believe me, those are very, very good services. I'm not saying anything about, negative about those, but I'm just saying in regards to that, people are not getting out. People are not being social. People are kind of staying within themselves. So you might see now, since the things are opening up, people are still very like, I don't want to go out. And that may be, a start of being agoraphobic. So you want to kind of look at that, reevaluate that, and, talk to somebody about that. And then you say, well, how can I talk to somebody? Well, how can I find out if I have, and these are just the 5 that I've basically seen in practice, and that's very, very relevant to our community. The way you can find out is you have to have assessment. And who do you get an assessment from? A therapist, okay, a mental health therapist, a substance abuse therapist, or a clinic, mental health clinic, substance abuse clinic, and you get assessed. Then they'll give you a diagnosis. And that diagnosis, will definitely interpret what's going on with you, and a lot of times they'll want to link you with counseling. It's a good thing, because if you don't feel comfortable going into the clinic or something, they have counseling now that you can do via telephone, via Zoom. A lot of those services, you don't have to go into the office. You can do, those services right at your comfortable at your home, but just make sure that when you do engage in those services, you're in a quiet place. You're not being distracted by the television, not being distracted by the kids, or not being distracted because that's basically your time to kind of work on yourself and kind of give the counselor what they need to make a good diagnosis and a true diagnosis. As far as um, diagnosis and prognosis. A lot of times, people be saying, "Oh, the prognosis is some of mental health diagnosis can be treated with counseling." Yes, it can be treated with counseling only, and that's fine. I mean, I'm a mental health therapist. I have my master's degree, some credits towards my doctorate. However, I can prescribe medication. So I would talk to your doctor and let him know or her know what your diagnosis is, and she can prescribe the medication for you. But a lot of times they want a psychiatrist to do that, so you partner with a psychiatrist and let the psychiatrist prescribe medication for you. Some people are very, very resistant regarding medication, and that's understandable. And with counseling, you basically are dealing with some issues that you have to correct to move forward. So medication may not be in play. But if it is, if they suggest medication, be open to it. That's not saying that you have to take it for the rest of your life, because a lot of people be like, oh, I don't want to take any medication. I'm going to be on this for the rest of my life, or I'm taking already other medications. And, you know, those medications coupled with these medications is not going to be good for me, and this and that and the third. No, you don't have to be on it for the rest of your life. You can ask for a mild dose, see how that works, just to get you over the hump. And if it works, great. And then, or if if it needs to be increased, let them increase it. Get you over the hump, address what you need to address, get you stable, and then after a while, trickle you down. Don't just stop, because a lot of times clients stop taking it after they feel better. Just like in the medicine world, the doctor say, "Oh, here, take an antibiotic," and you take half of it, and it may be for 2 weeks. And then you say, "Oh, I feel better, so I'm not going to take the other half." So you stop taking it. No, you don't do it like that. You take the whole thing, and then once the doctor reevaluates you, or whomever reevaluates you, then trickle down, because you don't want to be on medication. So that's the way to go. Don't just stop any medication. uh let's see. When you are looking for when you are diagnosed with something, like I said, I told you the channels that you do when you go get diagnosis and an assessment first, and then they give you a diagnosis. Remember, you find when you go into the clinic or when you go into an online practice, you are assigned a HIPAA form, and that HIPAA form protects you as the client. So make sure you sign that, because I don't care if your counselor is somebody if your counselor is your neighbor, if your counselor is your church member, or your friend of a friend or whoever. That HIPAA form protects you, and they can't disclose anything that you say in session to anybody else. If I don't care if you bring your child to counseling, okay, and you say, well, I brought my child to counseling. What's going on in counseling? We can't tell you what's going on in counseling. We can only say she's addressing her, or he's addressing his issues. That's it. Especially if they're over the age of, I think 12. We can't tell you anything. We can't even tell you if they're 5 what they say in counseling. So make sure you get a consent. If you have a child and you want to be privy to some of the information that they say, and just to protect you as a client, because people sometimes, oh, I seen her at the supermarket, I seen her at the clinic, and your business is your business and it's private. So a lot of times people shun away from counseling because they don't want to be looked on a certain way, or don't want to be, judged a certain way. But it's okay. Again, that is your business, and it's all about you moving forward with your life to do what you need to do for yourself. A lot of times we do, as clinicians, have to break confidentiality. And the only two reasons that we can do that is we have a duty to warn. A duty to warn, say you got very, very depressed and you was trying to harm yourself. That is when we can break confidentiality, because we don't want you to harm yourself. So we have a duty to warn. So we need to contact the police or contact somebody saying, okay, I think blah, blah, blah is about to hurt himself. So can you go over and do a safety check? Or, you know what I mean? Can you, or contact a family member or whoever was your emergency contact? Will contact that person and, let them know that you're not in a good space. And the second thing is, if you threaten to harm somebody else, You can be pissed off till the cows come home. You can say what you want, but if you have a firearm and you say, I'm going to blah, 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 this person, we have to, by law, warn that person or warn that individual. And that will be the second um, reason to break confidentiality. So just keep that in mind. I know you guys are not thinking about nothing like that, but sometimes, and I've had people in session, just blowing off steam, will say, "I'm so mad," or they're so mad I could kill them. Once you develop a relationship with a certain person and they say certain things like that, if their intent is to go out and kill them or they're just blowing off steam. So you have to use your own judgment in regards to that. So yeah, so that's basically those two reasons are the only reason that we can break confidentiality. So when you say, I went over prognosis already, I went over agoraphobia, and I went over the other things. Um, what what would you be looking at for? A lot of people came to me and was like, "Oh, I've been in a certain amount of counseling agencies for years, and these people and those people don't help me, and I'm really tired. I'm really, really frustrated." And you know one, you want to look at your therapist's credentials. You want to make sure that they have at least a master's degree. You want to make sure that they're you have a relationship with that therapist, because if you're coming in and you're guarded, I'm not going to be able to adjust anything with you. If you're coming in and you're not open to working on your issues, then we're not going to be able to do any work in session. If you're coming in and you already have a pre existing thought that you're not going to be able to help me, then you might as well just keep walking because it's not about me, it's about you. You have to feel comfortable, one, with your therapist. You have to be open to the process of therapy. It's not just one or two sessions. You have to, one or two sessions is basically getting all the information, be it background, be it, your environment, be it your history, everything. I mean, you have to do a whole assessment. So once you come in and you give all of that information, then after maybe a good month, then the work starts. You know what I mean? Then the work starts. And I always tell my clients, if we touch on something that you don't want to touch on, then we can hold back off of that, for now. But and just proceed with the here and now, the problem at hand, you know and that's totally up to your therapist. But a lot of times, coming into clinics, people try to you're people try to evaluate, okay, we'll switch you to this person, we'll switch you to that person. And I'm not saying anything about clinics. I've been working in clinics for over 15-20 years, and they are good and they are helpful, and people gravitate to clinics, and that's the way to go too sometimes. But if you need to work on yourself, you want to make sure that, one, your what credentials do your counselor have? Are you going to feel comfortable talking to them? Because if you're not feeling comfortable talking to them after a couple of sessions, then maybe that's not a good fit for you. And it's you have to advocate for yourself. Say you was in session with a counselor for maybe 3 months, okay, and you said, you know what, me and him or me and her is just not jiving. you know, they're not, what I think I need. It's okay to go to that counselor because we don't take it personal. It's okay to go to that counselor and say, you know, we're not really a good fit. Do you mind if I switch counselors? And if that doesn't work, go to that counselor supervisor, or go to a different agency. Again, you have to be an advocate for yourself when it comes to that, because, and then too, they may just say, well, what's wrong? Well, we're not talking about what I want to talk about. Well, what do you want to talk about? And then you tell them, and then maybe they'll address it. But if you just not say anything, and then for months on end, keep on going to that counselor, how is that going to help you or even help them know how to help you? You know what I mean? So you want to just make sure that you have that open communication with your counselor and blah, blah, blah. Okay. And be honest. Don't come in there. First of all, we're not judgmental. Okay. Everybody needs help from time to time. Everybody needs somebody to talk to. So don't think, oh, just because I'm in counseling, I'm crazy, or just because I'm in counseling, this or that or the third. No, that's not the case. You're in counseling because you have something going on in your life, and you're asking this person, an expert in that field, to help you move forward. Not to do it for you, but to help you move forward in that situation. So you have to be honest. Don't come in with a facade saying, well, I'm just this and I'm just that, and life is just perfect and everything is going the way I want it to go. Well, then why are you here? You can't come in there um, and not express how you feel, because how are they going to know to help you? So you got to be honest. Um, like I said, it's not, we don't take it personal. Well, Ms. V, I don't think that you're a good fit for me. Okay. Well, can I ask you why? Well, maybe you're too old, or you're too old fashioned. I want a younger counselor. All right, so we'll see what we can do. And then we'll get you a younger counselor, somebody that maybe can relate to you. I've had people come in and say that was older than me, saying I was too old, or younger than me, saying I was too young. So again, you have to talk to your clients. You have to, and some of them I kept, and we move forward, and some of them I didn't keep, because it's not about me. It's about them. It's about you moving forward and feeling comfortable moving forward, and you're there to get a service. And I don't care and I always tell my clients this, I don't care if you're paying with Medicaid. I don't care if you're paying with one of the high rank insurances. I don't care if you're paying for your services. You're the consumer. Okay, you're paying for it through your Medicaid dollars, or through your dollars. So if you're not happy with the service that you're getting, you have the right to get services or a different service somewhere else. So again, you need to advocate for yourself. um, so that's basically all I have. I have a couple of segments, and I wanted to talk about anxiety because this has been so to the forefront. Every time you turn on the TV, they're talking about anxiety with COVID, anxiety with children, anxiety, with adults because of COVID. So this is very serious. And I always tell people, mental health, you should have a mental health counselor or a mental health clinician, a psychiatrist, just like you got a medical doctor, because your mind is just as important as your body, and a lot of times they cope, if your mind ain't right, some of the things that your body will experience because of your mind, like all of these characteristics that I just told you, the heart palpitations, the hyperventilation, the shortness of breathing, um, all of that is your physical, so they work together. So just like if your body is not right, then your mind will start, to suffer. So have somebody to talk to, even if it's just somebody to talk to every 6 months, just to check in, just say, hey, I'm doing okay, or and we have things that come on in our life that's unexpected, of course, myself included. I lost my beautiful mother in 2020 to COVID, and that hit me like a brick, so, and I was talking to my friends. I was talking to, of course, I've been in the field for over, 20 years, but it never hit me like this before, and I'm a clinician. I know what to do, but it still impacted me. So you need people just to talk to, just to confide in, just to be supportive of you, and you'll get through whatever it is that you need to get through. So I have a couple of events coming up. And the TV shows, of course. I'm on DAP Productions Twitch TV on Monday, Mental Health Mondays, I call it. The Ask the Counselor show is on Twitch, and so I'm grateful for that. And then I'm also on Spectrum 1302 Ask the Counselor show for and that time is 1:30 on Sundays in the afternoon, and it repeats on Thursdays at 6:30. And then I have another TV show, and that's more of a just relax type thing, and that's called Vonnie's Let Me Entertain You. And that's on Friday night and Saturday night at 10 o'clock p.m. And let's see. Oh, and then I have a paint in therapy, and that's being hosted July 30th from 6 to 8. Call me or let me give you my email number, because call me for further details. And again, that's 6 to 8, July 30th. And my email address is mhcmsv, is in Victor, EE, at gmail.com. So I want to leave with 2 Timothy 1 and 7. For God has not given us the spirit of fear, but of power and of love and of a sound mind. So this is Counselor Ms. V. This is the Ask the Counselor show. Thank you for tuning in.